We are on a mission to help nurses integrate into this industry, and we really feel like cannabis has a capacity to be the catalyst for a healthcare revolution. And so we need cannabis nurses that are knowledgeable, that can teach patients, that can, be a good resource and a reputable resource for them, and be science-based and break the stigmas and educate patients and empower them. And, one of the things I focus on personally is helping patients find medical quality cannabis, because there's a lot out there that's not. And so we really are patient-focused, and, we see in this industry there are some people that are going kind of the pharmaceutical route, and we feel like if we become profit-focused, then those patients are going to fall through the cracks. So we are really going to be that patient center that is advocating for their best good. I was an acute care nurse until 2012, and I was working in a hospital and doing critical care nursing, and cannabis was not on my radar at all. And I became very ill. And, about a year into my illness journey, I had a complete health collapse. I was 20 pounds lighter than I am today. I had multi-system organ failure. I had chronic severe pain, brain fog. And cannabis actually got rid of all of those symptoms for me, and also kept me off of opioids, which as a nurse, that was my reason for starting cannabis, was to not go down that opioid route. And so it not only manage my pain, but it's also gone on to help improve my overall health and function. And today, about 7 years later, my autoimmune markers are actually reversed, which is unheard of with the mainstream approach. And so this is just, something that patients need to understand, that there's a safe and effective alternative to pharmaceuticals, and, and really break through that stigma. And so when they hear these stories, they begin to understand that there might be a better choice for them. One of the things that we teach really widely, and it's actually, if you go to my website, Integrated Holistic Care, under our FAQ section, there's a patient self-questionnaire. And these are asking about considerations of cannabis therapy and helping patients understand when they should seek medical oversight of their cannabis therapy. Things like pharmaceutical interactions or certain conditions that might need specific components and stay away from others. With CBD being so readily available now, you can buy it at a gas station, or college campuses. We want patients who are really seeking it for medicine to understand that there's a specific route to do so, and not just to go out and start combining CBD with things like warfarin, which can cause big problems. So we want patients to understand, even though anybody can get it and it's, very popular, that there might be reasons why you should seek a knowledgeable medical professional before you start cannabis therapy. The endocannabinoid system is our body's master system that promotes homeostasis or balance in our body. And when you consider, from a broad view, the underlying cause of every chronic illness is imbalances. So whether people are taking cannabis and they think it's recreational use, or if they're really targeting medical use, they're getting some medical benefits from that. A lot of people are self-medicating with cannabis. But cannabis, with the correct formulations, can really target those underlying imbalances and actually reduce the cause of chronic illnesses, versus, most pharmaceuticals cannot claim that same thing. I think the only one we can consider curative would be like antibiotics. And so it's a very different paradigm. And it's a challenge in this medical system, because we're so used to that pharmaceutical being the go-to. So we're trying to really teach that there might be a better first resort for a lot of these patients, because the pharma route for chronic illness really, you just end up having to take more and more medications. And with cannabis, we're actually seeing patients reduce their reliance on pharmaceuticals and improve their quality of life and function. Well, thank you, everybody. I appreciate you watching. Thanks.